if your house is on fire and the
If your
fire
house-
brigade...
They don't sprinkle water over everybody's house. Put the resources, and that just makes sense. With health, it's the same thing. You give the resources where they're needed.
This is not the first review or the first report ever to talk about health inequalities. It's like we're shoveling snow.
Yeah.
And there's an avalanche coming.
Stories, labels, misconceptions. NHS remains a blessing. Created in 1948. We want it to remain great. A podcast where we share our stories, explore solutions in all their glories. They say it's broken, but it's not done. With your hosts Val, Barrett, and Dr. Jeremy and the Sun.
Welcome to another episode of Stories, Labels and Misconceptions with me, Val Barrett.
And I'm Dr. Jeremy Anderson.
We're still doing the Health Inequality series. We're on episode 4. Episode 1 was What is Health Inequalities? Episode 2 is Tackling the Social Determinants of Health. And episode 3 was Who Gets Left Behind? Now, this week is about all the reports, still no change, why knowing isn't enough. So we know for decades, experts have written about health inequalities in the UK. Reports, reviews, government commissions all say the same thing, that where you live, what you earn, and even the colour of your skin can determine how long you live and how well you're treated when you're sick. But here's a question. If we know all this, why hasn't it changed? Why hasn't the dial moved? Today, Dr. Jeremy and I are delving into the growing pile of evidence, the political promises and the silence that follows. This is part 4 of our Health Inequality series. We're asking what happens when awareness isn't enough.
Well, it seems we have a tradition in this country of commissioning reports. They get mentioned when released, put on a shelf.
Yeah, gather dust.
And then we think about it 10 years later.
Yeah.
When another report comes out.
Yeah,
that seems to be the pattern.
But today we're going to touch on 3. So let's start with what we know. What are some key reports we've seen over the years? So we've got the Marmot review, which came out in 2010.
Mm-hmm.
What did it say and what changed since? Why do these reviews repeat the same thing, rinse and repeat? I think because nothing's changed. If you're writing reports about health inequalities and you've got the evidence and the government of the day hasn't implemented any of the recommendations, then nothing's changed. If anything, it's going to get wider, as we're going to discover next week. But why? I don't have the answers. I don't work in health. It just seems to me, as a person that depends on the NHS, that if you have commissioned an expert in health inequalities, they come back with evidence. They're not just singing it, they're saying, this is the evidence. And the evidence that Marmot produced was similar to the same evidence to the Black report, to the Akerson report. So why still then?
Right.
People don't feel change.
We've been talking in this country, reports have been commissioned for over 40 years. The Marmot report in 2010, authored by Professor Sir Michael Marmot, commissioned by the Institute of Health Equity. A lot of the findings are what we've been talking about on this podcast. People's health follows the social gradient. The lower you are in terms of socioeconomic status or your social position in society, the worse your health. And that's because health is not just about access to a hospital, although that's part of it. It's about inequalities from early childhood,
Yes.
how you do in school, what kind of employment you have,
How you live, the house.
how you live, where you live, social determinants like housing, income, education, more important than merely access to healthcare.
The 2010 one was called Fair Society, Healthy Lives, which we still don't have, which is a joke. Then they thought they'd bring him back, and he did another review in 2020 called Health Equity in England, the Marmot Review 10 years on.
Yes.
And the key objectives was, as you said, best start in life for every child, maximize capabilities and control, employment and good work, healthy standard of living, strengthen prevention of ill health. Now, the outcomes were widely praised. Well done. Report is brilliant. We're not going to enforce it. The same old. So it served as a framework for local authorities and NHS trusts. No national legislation was implemented.
Right.
Its influence was largely felt at local rather than national level. That's strange.
I haven't read the Marmot report from 2010, but just the objectives you've listed here, I don't know if that's exactly how it was stated in the report, but as an objective, it's fairly vague, right? Best start in life for every child. Okay, that isn't something you can just legislate, right?
Yeah.
I saw online, there's a stat, if a man can drop and do 40 push-ups, 10 times less likely to have a heart attack. Okay.
But then
So-
how many men can do that?
How many men can do that? And it's not like you could just pass a rule. Okay, everybody, you have to be able to do 40 push-ups. Yes, it would be great to get to that point where every man could do that, but you have to go further. Okay, so if someone can't do a push-up, how do you get to a point where you could do 40 push-ups, right?
Perhaps he'll never be able to do it.
Well,
Because of disability, as you said, it's easy to say this. It's easy to say
Yes.
A, but we've got to look at the barriers and the obstacles
yeah,
to get to A. Because
exactly.
you'll have people that can get to A like that
Yeah.
without any help, any resources.
Yeah,
But you'll have that middle group that will just about get there, but need additional help. And then you've
Exactly.
got that group that just can't get off the starting blocks, no matter what they do. And those are the ones that, if they can't get off the starting blocks, they're going to get worse.
yeah,
Where middle, at least they have a chance.
yeah. Thinking about the third objective, fair employment and good work. Okay.
Ooh.
As an objective, it's not like we have perfect control over that. Right? What
Yeah.
if the economy goes down the toilet? What if there are no jobs? Right? We don't always have control over those things. So it's hard to implement some of these things.
And plus, we got 0-hour contracts.
Yeah.
And then we got this fire rehire thing that happened as well. Work is no longer stable. When I was
Yeah.
growing up, my friend's dad was retiring, and she said he worked at the same place when he left school. I find that hard to believe there's anywhere like that now, where you're there for 40, 50 years. Too many businesses are closing down. People are not earning enough. They're having to do 2 jobs, 3 jobs.
Yeah.
So the days have gone where parents just did the one job.
Yeah. I don't think there's anywhere I've seen where people work the same job their whole career.
No.
I think that's a bygone era.
Yeah.
But also, if we think about this report was written in 2010. What
Yes.
happened in 2010?
I can't remember last week.
Well, we had the
Oh,
financial
blimey.
crash of 2008, 2009. The government brought in austerity around 2010.
Forget in 2010 I was a baby.
All of us were too young to remember what happened in 2010. But there were major economic downturn that happened. And so some of these things might have been a good idea, had the opportunity to do it, but there were choices that were made. There were, conditions the government was dealing with that meant a lot of this stuff didn't get enacted.
Of course it doesn't.
Yeah.
It was Labour in 2010.
When did the Conservatives come in with David Cameron? In fairness, I wasn't living in the country at the time.
David Cameron became Prime Minister 11th of May 2010.
Almost halfway through 2010.
So what could have happened is it could have got commissioned before Cameron came into power, but
Correct.
it got published under his government.
Cameron came in, austerity came in. The report had been commissioned and published, but relatively little got acted on because of the situation the government was dealing with.
It's so strange because in this review, the key policy objective was best start in life for every child.
Yeah.
Now, as we know, when Tony Blair's government were in power, they had all these sure starts. In 2010, they were significantly reduced, even though this review mentions every child should have the best start. And that is what Sure Start was about.
That's a key example of the report saying we should do something, and Sure Start was a way to address that. But then austerity hits. Those things get cut.
Yeah, and many of them closed. And it's sad because inequalities hasn't gone. Isn't it strange that when austerity happens, the first thing, as we all know, it's a race to the bottom. What can we cut on the ground? But then, as we know, with further reports and how health inequalities and data have gone on since then, health inequalities has gotten worse for children and adults. So cutting these things, as we spoke before, may, in hindsight to them, save money, but we know further down the road it's going to be a bigger cost.
Right.
When can we have foresight? We need to make cuts or reform. Why is it's got to be at the detriment of the ones that really need the help and support? A child has no control over the family it's born into, where they live, what mummy or daddy does for a living. No control over whether they're born into poverty. But that shouldn't be the end of that child's story. Do you see what I mean?
Yes.
It shouldn't determine that they stay in poverty for the rest of their life because the government wants to make cut. How is that child, when they grow up, going to become a productive member of society if all they see around them is failure, abandonment? It doesn't make sense. And then they see the rich getting richer. That's not a fairer society.
No.
And I think sometimes when people hear that people at the bottom are going to get more, they think things are going to be taken away from them.
Yes.
But the understanding is a little bit might be taken away, but if it's not taken away now, a larger chunk is going to be taken away later on down the road because things then have gotten worse.
I think that's a key point, really, that I've talked about before, this distinction to be made between equity and equality. For some, equity, helping some people more than others, has become a bit of a dirty word, as if it's masquerading as equality, where everyone gets treated equally. And if you think about it as these people are getting something and I'm not, that can feel unfair. But I think healthcare is an area where it makes perfect sense to have equity rather than equality. If you get a stent, it doesn't mean I need to get a stent too. If you get a blood transfusion and I don't go around saying I'm not being treated fairly because someone who needed a blood transfusion got one and I didn't.
Or if your house is on fire and the fire brigade...
They don't sprinkle water over everybody's house. Put the resources, and that just makes sense. With health, it's the same thing. You give the resources where they're needed. We're talking about equity rather than equality.
Okay. Well, let's quickly go on to the 2020 review. Because it came back 10 years later. And 10 years later, the Tories are still in power.
Correct.
So let's look at the key findings for 2020.
Okay.
So the 2020 review was called
Yes.
Health Equity in England, the Marmot Review 10 years on. Ask me again. No, I've made that up. He should have put that in the forward. These people don't listen.
Yeah.
So within those 10 years, guess what happened? Do you think it might be a trick question? I want you to think about this. Remember, your PhD depends on this.
Okay.
He comes back. He's already said what he said. He
Mhm.
comes back 10 years later. Do you think health inequalities lessened or widened?
I think they widened. Got worse, right?
Of course it did.
So,
It did.
so we had austerity cuts. This impacted people's health. Who suffered more, the rich or the poor? Probably the poor, right? But these health inequalities got worse. And what I thought was interesting is, particularly between north and south of the country,
Different.
things were getting
Always.
worse. But the conservatives were always talking about leveling up the north.
That didn't really come in, or that song wasn't sung till much later. Right now, we're on the Inequalities tune. Same old song. The dial hasn't moved forward. The dial has moved back.
Yeah.
Within the 10 years, so the 2020, it highlighted that life expectancy had stalled for some, and it even declined for the poorest, while the amount of time people spend in poor health increased. The report emphasizes the need for action to address the social determinants of health, including education, occupation, income, and community. That's what he said in 2020. And I'm sure Professor Marmot is still saying the same thing today.
Of course.
I think he should just record it. And when he's asked to go to a committee meeting, he just presses play.
Yeah.
Guess when I recorded this?
Yeah.
And do you think anything's changed? No, it hasn't.
Yeah. What happened in 2020? COVID, right? End of 2019, early 2020, that COVID pandemic, right?
I can't remember.
So it's just, once again, there's this report, there's recommendations made, but then something comes along and derails it.
But don't forget, even though we did the review in 2020, things were getting worse before COVID, and COVID made it even worse.
I'm not disagreeing with that at all.
I think the lockdown,
Yeah.
the lockdown of certain appointments for people with cancer and ongoing chronic illnesses, that was bad.
The original report in 2010 said, here's these problems, here are the things you should do to fix it. And then the financial crash happened, and the government came in and said, okay, we're going to do austerity, that's going to fix it. And by 2020, they come along and say, no, actually, it didn't fix it. It actually made things worse. Here's some things you need to do. Then COVID happens. And
I do understand that in politics, not everyone can get what they want. Not everyone can get a bigger slice of the cake. I get that. But then it's about priorities. It's where you direct those funds to. Is where you think at that time the government of the day believes is more important.
Yeah.
Do you see what I mean? Because money's always going to go to health, money, education, housing, but it's where the money goes.
Yeah.
So they thought the easiest thing to do was to cut back on Sure Start. Sure Start.
Yeah.
For babies, children aged 5 and under.
Yeah.
It says a lot.
When
you have a bunch of people on the front bench, this is the Tory government, when you had Cameron, Osborne and whoever else, and you had a bunch of people that are not ever going to be in poverty. Their children are not ever going to be in poverty. I know their families are quite well off Do you think, as a psychologist, do you think that makes a difference? That the people making these decisions, do you think they need a better understanding of what it's like to live in that position? Do you believe that?
As a psychologist, I think the way to change people's behavior is to give them better information. People make decisions based on the information they have and what they think is important. If they have the wrong information, they make bad decisions. If people have better information, they understand why something is relevant and better for them, then they make better decisions. My wife works in education consulting and once went to, I think, Kazakhstan. She was doing a review of their education system. And so the reason she was going is because countries compete to assess their education systems by certain tests kids take when they're about 15 years old.
Yeah.
And so they compare the education systems around the world. And countries are always wanting to increase their score on these tests. And she and some other consultants were hired by Kazakhstan to review their systems, see what they're doing right, and see how they could improve their scores. And what she was saying is what the government there was doing was they were putting all their money into these elite kind of schools. Students who showed they were smart would go to a specific school, and that school would get all the funding to try to push them to the heights of education and productivity and all this kind of stuff. And okay, that was all great. But what my wife was pointing out is if you actually want to increase your score, you get more bang for your buck. If you put the money in places that don't have it, it's cheaper to raise a whole lot of people up. Even if those people don't go on to the super high elite levels, just if your baseline level is higher overall, you get a better score, and societally you get a better outcome. If we apply that to health, put the resources where people are suffering most, you can improve their lot in life a great deal with a lot less resources. It's more efficient to do it that way than it is to try to pour huge amounts of resources into it.
It's interesting when you mentioned that, when I asked you the question, do you think it matters that they should understand poverty more? But when you said as long as they've got information was there, they had it in 2010 in black and white. I'm sure they sat down with the professor. This isn't, as we will show next week, this is not the first review or the first report ever to talk about health inequalities. It's like we're shoveling snow. And there's an avalanche coming. And that's health inequalities because they're not taking a hold of it. What happens, they'll start something good, like Sure Start. New government comes in, and this is where they play politics with people's lives. People's lives are not your political game. They come in, make cuts, and they cut it. People in the neighborhoods needed it most because it was targeted. They're the ones that lose out, not the ones that live in Notting Hill.
Exactly. As a psychologist, I'm thinking of the concept of ambivalence. Leadership is ambivalent, getting pulled in different directions. You can give them some information that's pulling them in one direction, but there's other information, there's other factors that are pulling them in other directions. And that's normal, right? And clinically, when people want to make a change, let's say they want to quit smoking, right? But they also want to keep smoking because they enjoy smoking. So they're pulled in two directions. To deal with that is actually to get people to focus on both things that are pulling them. So they feel that conflict, that discomfort. By doing that, people understand what they really value, right? Yes, it's true. I enjoy smoking. There is something I get out of it. But at the end of the day, what I really want is to not get lung cancer. I think our leaders need to recognize they're being pulled in different directions and figure out what we want for the country.
I think, as they say, is advised, ministers decide. But when you look at the departments, 1 minute, someone's the Secretary of State for Health. The next minute, they're the Secretary of State for Transport. In real life, you are clinical psychologist, would you go and apply for chief executive of transport?
No.
See what I mean?
Oh,
So
yeah, that's the crazy thing about government.
never there
Yeah.
for the long term. They
Mhm.
have a reshuffle as if that's going to make some kind of difference. No, it doesn't. Makes it worse. There's no
Continuity?
continuation
Yeah. Yeah.
in that department at all. Everybody wants to put their stamp on it. And when they talk about taxpayers' money, we've got to prove that we're spending it well. Well, stop doing these bloody reviews and reports then. It's like they think by showing the country, look, we're doing another report, they're doing something.
Mm-hmm.
Do they ever tell the country that after the report is published, they're doing sod all? They
No.
shelve it. And that's it. It's like pissing money up the bloody wall.
Mm.
These things get me angry. There's only one pot of money, and all the money is taxpayers' money. But the only time they sing that song, that sad old song, taxpayers' money, is when people in the public sector want a pay rise, or it's about people on benefits.
Mm-hmm.
They don't sing that tired old song, taxpayers' money, when they're giving themselves a rise.
Yeah.
Or they're giving out contracts to their buddies that know sod all about PPE. They don't sing that song again, but it's still taxpayers' money. All of it. And it seems like people swallow it. They only make noise when the public sector want a pay rise or people on benefits. I didn't hear much noise about the PPE, all those millions and billions gone up in smoke. Where was the noise for that?
No,
We're
that got some
outraged.
attention, but nothing really happened, did it?
As Chris Rock, one of my favourite comedians,
Mm-hmm.
we have selective outrage.
Mm-hmm.
It's still taxpayers' money. Where's the outrage about all the money they spend on paracetamol, aspirin and ibuprofen? Did I say it right?
Close.
Where's the outrage?
Yeah.
Where is it?
Yeah.
You want more money in health. You want your waiting time to get lower. You want your operations. You don't want them to be cancelled. Get outraged about every penny your government is spending. It shouldn't be dedicated to one group. It doesn't make sense to me.
Mm-hmm.
They have a responsibility to every taxpayer with every pound and pence and shilling and tuppence that they spend.
Yeah.
Yes.
No argument.
So, mock review, as we said, 2020 life expectancy had stalled. Yes. Not a surprise. Health inequality had widened. Woo, what a surprise.
Mm-hmm.
Austerity measures from 2010 onwards linked to worse outcomes. Local government cuts, especially in deprived areas. Cuts in areas that need it most. Impacted services that determine health. You're cutting housing, education and public health.
Mm-hmm.
So the outcomes. These were timed just before the COVID-19 pandemic.
Well,
and it had a renewed push for cities like Coventry to adopt equity frameworks. We must check that out and see if that is still going on. There's still no legal duty or central accountability for implementation. These people make me want to cry. They really do. Why have something like this and there's no accountability for implementation? None at all. It makes no sense to me. They're quick to implement when the government body that looks at MPs' pay.
Oh.
Yeah, but they never say, we don't need a pay rise. I've got 9 jobs. They never say that. They never turn it down. They never say, look, we have an austerity. We're living in hard times. Our people are going through it. We'll go through it too. They don't. They take that money. They don't argue with that. They implement that. but they don't implement health reports that will help deprived communities. But they
Yeah.
implement their money when it's going to help them. They always say, we don't set the pay. We don't set the pay. Yeah, but you can refuse it or donate it.
Mhm.
But you don't have to accept it.
Yeah.
Supposing one day you get paid for, what's it called?
But you're paid based on performance rather.
That, yeah, you're paid, but you see how quick they implement that health equality.
Yeah.
They've got to do better. You know, you're an MP for a reason.
Mhm.
Everyone has a personal reason why they work in public services, the reason why you're a nurse, the reason why you became a doctor. And to be on a platform where you are an MP,
Yeah.
you want to do good for your country, your constituents. There has to be something needs to change in
Yeah.
order to make them do better.
Okay.
She had the budget the other day giving away money like Haribo's.
And
Where
there's-
is that money in health? How much of it is going to pay for consultants, management?
Mhm.
How much of that is going to go to red tape?
Mhm.
Compared to how
Yeah.
much is going to go directly
Yeah.
to the front line? That's what we need to know.
We're bashing politicians here. You're not going to get any
We're not
argument from
bashing
me.
them. I'm not.
We're pointing one finger at them, and fair enough.
Yeah.
But I want, if we switch gears for a second, I think one of the reasons why there's many reasons why governments don't have the money to do what they want to do, and I think one of the reasons is taxation and a kind of inability to adequately tax the wealthiest entities in our society. Really wealthy companies generating vast amounts of wealth are not paying a lot of taxes. These companies are earning huge amounts of money, but not contributing back. And particularly in the tech sector, a lot of these companies have made their fortunes disrupting existing systems. And that means someone is suffering when your company does well. So when Amazon does well, other companies are not doing well, go out of business.
Yeah.
They've been replaced by Amazon.
There's a place with AI.
Right. That's a perfect example of something coming in the future. I don't think it'll come as quick as everyone thinks, but I think it is coming where certain entities will have all the wealth. If a vast number of people who don't have it, and if the government, if they can't tax it and redistribute it, then we're in a very strange society where there's just all this wealth concentrated in one area and everyone else suffering. I don't have a solution, but we need to find a way to adequately tax those that have the wealth.
Is it about taxing our way out?
Whether it's tax in the traditional sense or some other redistribution method, I don't know.
They've got to get people into jobs.
Yeah.
They've got to. It's simple. It's not simple, but you shouldn't have country in the G7 country like the UK, where so many people are sick that want to work but need extra support. The second was the race disparity audit done in 2017 for the 2020 Marmot review. This was launched by Theresa May, entitled Ethnicity, Facts and Figures. There were significant racial disparities in health, education, housing, employment and criminal justice. Black women were 5 times more likely to die in childbirth. Ethnic minority groups were overrepresented in low-paid work, had poorer mental health outcomes.
Yeah, I think that's very relevant for my profession, given I work in mental health.
And had less access to tailored healthcare. And it said Black, Caribbean and Pakistani communities were more likely to live in deprived areas. I'm sure that hasn't changed. And this doesn't help me anyone else I know that's interested in health inequalities,
Mhm.
when you see these things written down. And
How does that
and
land for you when you see it written down or read it?
When you see it, this is why I got involved,
Hmm.
though. When you see something like that, whether it's about me as a black woman or just about communities in general,
Yeah,
you see the figures and you realize it just isn't fair.
yeah,
And you want to do something about it.
right.
Before you see it, you're oblivious to it. You're trying to get a job, but you're realizing it's hard.
Yeah,
But
yes,
you're not going crazy because you haven't seen the figures. No one's telling you this is why it's harder for you. I live by that rule that you need to help yourself if you're able to. There's a percentage down to government.
hmm
There's a percentage of it that's down to communities. And there's a percentage of it that is down to you. I understand. I have a child with a disability. I understand that some people will always be dependent on certain resources to
sure,
get through their lives, to make it through the day, whether it's a carer coming in to do tasks for you, keeping you clean, keeping you fed. But if the government doesn't give that percentage and the community doesn't give that percentage, you can't help yourself.
right.
You can't. You need the bootstraps. It's all right saying pull up your bootstraps, so you need to give me the boots. The government needs to give me
Mhm.
the boots. Community resources are the straps
Yeah,
to those boots. I might need help to pull them up a bit.
right.
Do you see what I mean? No
Mhm.
one, rich or poor, has done it on their own. They expect somebody in a deprived area with minimal education who's
Mhm.
probably been grown up in the worst circumstances ever. They leave them to their own devices. No one, millionaires don't do it alone. No one does anything completely on their own. So it's unacceptable to allow those that need the most help, the most support, to leave them with sod all when you've had everything at your feet. Your
Yes.
life was mapped out for you.
The last point you read out about these communities more likely to live in deprived areas.
Mhm.
And if there's a deprived area, why is it deprived? It's deprived at a systemic level because
Mhm.
funding is allocated
Yeah.
is usually based on sort of property values or something.
Yeah.
So that areas that are poor have less money, they become deprived, and therefore it's more difficult for communities that are poor to not be poor. Whereas there's another choice to be made where you could say, okay, we're going to pool the money from everywhere and we're going to distribute it evenly, or even we're going to distribute it where it's needed most.
Mhm. Mhm.
That would help poorer communities not be poor anymore. And yes, that would mean that communities that are quite wealthy are enjoying a very well funded or even overfunded sector might lose that. They might not need that.
So, for the outcomes of this audit, made data more visible through the Ethnicity, Facts and Figures website. It changed everything for somebody like me because it was there right in front of me. Because then you want to do something about it. If it's just based on my ethnicity,
Mhm.
well, what can we do to make two women who are of different ethnicities
Mhm.
have the same service, the same outcome
Mhm.
as our white counterparts? Because we're not saying a new service needs to be provided. We need to be treated equally, listened to.
Mhm.
It surprised me. But it also led to some targeted programs on school exclusions and employment.
Reducing school exclusions.
Hopefully,
Yeah, that would be the aim of the program.
yeah.
Yeah.
Some people don't like the targeted approach to employment because it's easy to say
Hmm.
it's the best person for the job. That's so easy to say. It is, because then
Yeah.
that tells me that other groups are not as good as the white group.
Mm.
And if somebody of color got the job, it's always they got it because of their color. It's never they got the job because they're qualified. Do you know how insulting that is?
Hmm.
Two
Yeah.
men just like yourselves
Hmm.
have the same PhD, same grades, same experience and everything. The only thing that's different is ethnicity.
Hmm.
Say the black person gets the job. Some people think they got it because they're black. But that person had the same qualifications and experience as you. But they're
Yeah.
never given that credit. It never is. And they've got to remember why
Hmm.
all these programs came in, because it showed ethnic minorities weren't getting jobs higher up, not because they weren't qualified. I've never applied for a job I'm not qualified for. That makes no sense to me. I hope no one does.
I can tell you, as someone involved in hiring maybe 30 applicants for this job, and it was amazing how many applied who met none of the essential criteria.
You're kidding me.
Oh, no, not at all. And yeah, we had people who had absolutely no relevant training or experience.
Oh,
Someone applied with a blank application. They didn't write anything.
what? Why?
I have no idea. Those people don't get the job, right? If you've got 30 people applied for a job, we don't
Yeah.
interview 30 people. So if you don't write anything about yourself, we can't evaluate your application. So that person doesn't get an interview. But there's a lot of weirdness in hiring. I do
Yeah.
recall hearing about this is many years ago, and I can't remember if you I don't know if you remember this or not, but I had heard that there was a low number of people of ethnic backgrounds being hired in finance or trading stocks
Really?
because they would show up for an interview and there was an unspoken rule
Mm-hmm.
to wear black shoes. Maybe more people of an ethnic background were wearing brown shoes.
Oh, God.
On that basis, they were saying this person, they look good on paper, but they just don't quite fit in. So they would get weeded out.
Really? Just on you? What about class? Because
Well,
I remember this guy.
yeah.
He has
Mhm.
a YouTube channel. I
Mhm.
can't remember his name. Talks about stocks, stock markets.
Mhm.
He's white, working class. Never saw anybody that sounded like him.
Yeah.
It's not just color.
That's a huge thing in the UK. Friends of mine who were born and raised here talk about the importance of accent and the judging that people engage in.
Yeah.
If they hear your voice, even if they can't see your skin color, they make assumptions about where you're from, what your parents do, what kind of school you went to, and what
Yeah.
job you're likely to do. Now,
Mm.
as a Canadian,
Or
that's over my head. I don't
yeah.
get it.
When I was growing up,
Hmm.
I never saw anyone who read the news or any presenters that had a regional accent.
Hmm.
Now, you look in government, you've got all kinds of Midland
Sure,
accents,
sure.
Northern accents. I remember the
As it should
BBC
be.
had a lady on, I think it was on BBC News, that talked about finance. Sure, it was finance. And she had a Northern accent.
Hmm.
And it was very unheard of because they seem to like that cut glass accent. You don't have one, let's say. But it's changed slowly. It has
Mhm.
changed. To think that was a barrier to somebody who's got those qualifications,
Yeah.
not being a main presenter, talking about the thing that they're qualified for, based purely on their accent, and in some cases, their gender.
Mm.
So things have changed. I've got a friend, a very cynical friend, said, nothing's changed. I said, no, you're wrong. As much as I stumble across barriers still, I
Yes.
will always say things have gotten better.
Yes.
They
While
have changed. They have
yes, while things still need to change, we need to
Yes.
recognize the things that
that
have. Yeah.
have.
That leads to the next point. In 2021, the Commission on Race and Ethnic Disparities claimed the UK no longer had a systemically racist society.
Didn't we talk about this the other day, that you can put all these recommendations and the one that sticks
Is the term racism?
is
And I think this is a good example because they're
Yeah.
talking about systemic. So just for people who haven't heard that episode, when we talk about systemic racism, we're not talking about old-timey overt racism. I don't like you because of your group membership.
yeah.
That's classic old-timey racism. Systemic racism is really talking about, it's not saying anybody is personally racist. It's just saying that the system
The system.
is not aligned
Yeah.
to specific ethnic groups' needs.
Yeah.
That's all it means. And I think we can acknowledge the system isn't aligned perfectly to every group's needs.
Do you think they would react differently if the word racist was put as class? Because class has nothing to do with colour.
Or if you just said systemically unequal.
They'd
Right.
be able to swallow that better.
I think people like the idea of equality, right? Like a more equal society.
Some see it as a threat to that status. They feel that so when the government gives more or concentrates on one particular group or targets a service for one particular group, it's taken away from them.
It's perceived that way, yeah.
But it's not taken anything away from them. Sometimes it's to do with the fact they've never had to fight for equality.
Yeah.
So they see it as a threat. Just like the house burning down, the firemen come to put out your house, next door come out and say, what about mine? But it's not your house that's on fire.
Exactly.
Do you see what I mean?
We don't sprinkle water on everyone's house. Right? Right?
Not yet.
We turn hoses on houses with fire.
And at that time, our house was burning down.
Yeah.
Be thankful it was never yours.
Exactly.
And for a group to have never had to fight for equality and having to battle every day through so many barriers. I read a story today in the paper, in the Daily Mirror, and it's Lord Victor Bauye. I cannot pronounce his name. I do apologise. He's a life peer, a crossbencher, I think. Yeah. He does a lot. He does a lot of work. He's the chairman of the NHS Confederation. He was saying, giving the story about his mother, who was, I think recently, she passed away aged 92, and she was a nurse for 45 years in the NHS. But yet, she was a nurse, and yet she faced a lot of discrimination when it came to treatment. And this is a woman that knows about health, that knows about the system, knows about the NHS.
Sure.
And what he was saying was his mother is a solid example of a systemic problem. It's important that people like me are not seen as above it all. So he thinks even though she lived to 92, some of the years she lived in discomfort. And they believe she was undiagnosed with cancer, that she wasn't diagnosed. He says, quote, I think she got a black service, not an NHS service.
He means she got subpar service.
Yeah.
Yeah.
She presented in A&E in a poor condition. It was a busy day and there wasn't space for anyone. They had to be a negotiation to get her a space. He said it made him angry because how can you live that long with something and not be diagnosed? It looked like she had lung cancer. She never smoked, lived a healthy life. It's sad because this wasn't a lady who wasn't au fait with the system. And her son
Mm-hmm.
Wasn't as well.
Yeah.
I've seen him a couple of times on Question Time.
Mm-hmm.
So there was no language barrier, educated. So you think if that can happen, something like that, then the issue must have been, as you say, skin color.
Well,
That's their experience.
yeah,
Everyone is entitled to talk
yeah,
about their experiences. Whether anybody agrees with it, that's up to you. Everyone's
and,
entitled to tell their
yeah,
story of how
and
they were treated.
that's why I was thinking talking about systemic inequality would resonate better because no one who listens to a story of saying someone had cancer that went undiagnosed potentially because
Mhm.
of skin color, no one is saying, no, that's perfectly fair. No one says they want that to happen.
Yeah,
What we want is everyone who's got cancer, lung
yeah.
cancer, or anything else, we want everyone to have equal access to diagnosis and treatment. We want better outcomes for everybody. And if someone is not getting the outcome that they should, we
Hmm.
want that to stop, right?
She'd passed away in January.
Yeah,
Yeah, her name was Grace. He told Derek at the
yeah.
NHS Confederation
Mm-hmm.
Expo in Manchester this
Mm-hmm.
week. It was not the dignified death we wanted for her.
Mm-hmm.
It wasn't the death she deserved. It makes clear the need to address inequality. I'd love to meet him. He's always been a fighter about health inequalities,
Yeah.
NHS, which we will talk about.
Yes.
Okay, another bit of the outcome was many critics argued the government failed to act on the data. Is that a surprise to you, Dr. Jeremy?
Not at all. I think that's the overarching theme of all the reports we're talking about and what
Same
we're going
old
to continue to
song,
talk
same old tune,
right.
by a different prime minister. Same old tune. My cynical friend says nothing. He said, this is how it's supposed to be, Val. This is how they want it to be. But even if he feels that we will never have equality as in 50-50, it shouldn't be this bad. Do you know what I mean? It
Yeah.
shouldn't be
Yeah.
this unequal, where it looks like we're living in two different countries.
So that's a really good point. If we could magically snap our fingers and make society the way we want it, we probably wouldn't want everyone to have exactly the same outcome no matter what, because that kills incentive. We don't want someone's hard work rewarded like someone who does nothing. We want to incentivize people.
Yeah.
The issue I have, and I think most people have, is they don't want that incentive to be so extreme.
Yeah.
We don't want the disparity so large. People with relatively small differences in IQ, geography, gender, or privilege being fabulously wealthy, super yacht after super yacht. We want people to feel rewarded, but not necessarily entitled to fabulous wealth.
But supposing somebody has invented something everybody uses.
Sure.
We know there are individuals out there who haven't been born with a silver spoon, but they have made something of themselves and become fabulously wealthy. That's not their fault.
No,
And
yeah,
I can't blame them
yeah,
for issues in deprived areas, because that's down to government, how they distribute the wealth. You know, as I was telling my friend today, we were talking about resources, and I said, look, I'm not wealthy. I get good service because of the postcode I live in. That's the bottom line.
yeah,
That's not down to skin color, not down to gender. It's down to the fact of where I live. I am within reach, walking distance of 3 major hospitals. My GP, I go on to the consult online. I get a call the same day to go in. I get phone calls out the blue from my GPs
yeah,
to see how we are doing.
yeah,
I get support from the local authority as a carer. That's down to the postcode. That's down
Yeah.
to the people that work in that postcode. He was saying, "No, but you've got too many." I said, "The Royal Brompton was built years ago. It's not new. If they were going to build a new hospital now, it wouldn't be in this borough."
Yeah.
So that hospital's old. Don't forget, when it was built, it specialises in lungs. And the other side of me, designated heart attack unit, and I happen to have a heart attack.
Yeah.
This is my personal experience. In reality, you're not going to have everything on your doorstep. I'm just fortunate that I have.
Okay.
I can basically say I do.
Yeah.
So what can we do? What can the government do in areas that don't? Because we talked about rural areas.
Yeah.
There's going to have problems with transport links.
Yeah.
People working 0 hours. You can't afford to take time off to see their doctors, to get the checkup. See what I mean? To see if they have cancer.
I think people do need to be compensated better.
Yeah.
And I think that requires changes at the system level, but it requires people who are very wealthy or with a lot of power to give up some of that wealth. And have I ever talked to you about Peter Singer?
No. Why should they give up some of their wealth? I don't have any to give up. Somebody was wealthy here. They might say, "I've worked hard. I've invented X, Y, Z, and it saved whatever. Why should I give up more of my wealth when I pay X amount of tax?"
Peter Singer, I might be getting his argument wrong, but imagine you're walking by a pond, see a little girl drowning.
Yeah.
What would you do?
You don't know. Some people jump in.
Yep.
Some people freeze. Some might phone someone. You don't know until it happens. I like to think we'd jump in.
Assuming you're able-bodied and not risking your own life.
You can swim.
If it's just a matter of getting your shoes wet, you grab the little girl and save her life.
Yeah.
Right? Let's say you send £10 to a charity and you can save a little girl.
Okay.
You can save the life of a little girl.
Okay.
Right?
Yeah.
Should you do that? If you give £10, you save a life. If you don't, that person dies.
Let's say
Yeah.
I'm the wealthy person here.
Yeah.
Paying all my taxes. I have a charity. I also give to charity.
Yeah.
I get other people to give to charities. So we have to admit there are loads of people out there. Some don't think about it. When they've passed away, people tell stories about how they got contacted, like when George Michael died. People said, "Oh, they contacted and blah." Under condition, they don't say anything. So there are a lot of wealthy people that do a lot of good.
Absolutely. I'm not arguing with that at all. What I'm trying to illustrate Singer's position, he would say is even if you weren't wealthy, even if you just got £10 extra, you're not a wealthy person, but you have £10. If you spend that on yourself and you get, I don't know, you get a takeaway, right? You spend a little extra money, or you send that and you save a little girl, right? On Singer's view, it's immoral to buy the takeaway when you could be saving a little girl. Singer's view is considered extreme, right?
Who is he?
Peter Singer, the famous philosopher of ethics.
From where is
He's from Australia. I can send you a link if you want to read more about him. What he's arguing is that any amount of disposable income that you're just spending on frivolously on yourself, when you could be saving the life of a human being, he's arguing, and I'm not saying I agree with this, I think there's something to be said against it, but he's saying that's actually immoral. That's his claim.
And who has disposable income? Now,
I've got disposable income. If I buy Jean-Guy a little dog toy, I spend $10 on
dog.
Sure, but I don't need to buy a dog toy. He's not going to die without a dog toy.
No, but then we can justify everything. Do I need that new top? Do I need a haircut?
Exactly.
You didn't need a haircut, but you still did it. So we can justify it. Bloody end.
That's a good question. I think Singer would argue it ends pretty far down that road, but I don't know.
Singer needs to sing another tune.
I think it's an interesting idea, but maybe we're not going to go that far.
No.
There is a lot more fabulously wealthy people could do, and it wouldn't cost them. Bill Gates is giving away 90% of his fortune. He
That's Bill
still has a
Gates.
super yacht, right?
That's up to Bill Gates.
Yeah,
That's his right. That's his choice. Not
Right.
everybody's going to be doing that.
hmm
So I don't like what singer-songer said. There's no disposable income. You have to save for a rainy day.
yeah,
If you own your home and something happens to your roof, you're not in social housing, so
Yeah.
you have to fix it.
You gotta
But
pay it.
you
Yeah.
decided to give that disposable little income away.
Yeah. That's a perfectly
It's
reasonable
hard.
objection.
There's no such thing now as job security. AI is coming for your job, Jeremy.
Why do you think I'm doing the podcast, right?
coming for us all, my friend.
AI can do a podcast, but do people want to listen to a podcast from AI?
Don't
They probably are.
realise we
Yeah.
could be AI. And
I
they don't
promise-
know. Bad woman don't know about that.
Mm.
But yeah, we could go all crazy about that. But
Yeah.
believe me, I'm going to advocate for the wealthy. I'm not wealthy. They do a lot. And then you've got that middle income group that
Mhm.
also do a lot. They
Yeah.
give money to charity.
hmm
Because there was a statistics done where I heard that it's not the wealthy, it's that group that have just a little bit more than just about managing, that always constantly giving to charity.
Yeah.
There are people that do that.
Mhm.
You know, we need to pressure the government and get them to distribute the money better, to be more effective. Go
Yeah.
after, right now, they're in court trying to get some of that PPE money. They need to look at savings and things like that, and contracts and everything that
Yeah.
goes into taxpayers' money.
Yeah.
You
And
know,
and I was thinking about this the other day. It may not be simply a matter of taxing that's going to lead to greater equality. But there's plenty of other things like home building. The cost of housing is so expensive, and there's not a lot of social housing. If we went on a home building spree, not necessarily just government contracts for social housing, but even
Mhm.
developers building a lot of houses. If you build houses too quickly, house prices fall a little bit. You wouldn't want it to crash completely,
Yeah.
but house prices might go down a little bit.
Mhm,
right?
mhm.
I have a mortgage, so I don't fully own my house. The bank owns my house.
Have disposable income and mortgage. I'm moving in.
I'm paying a certain amount, right?
Uh,
If my house price goes down, I'm taking a hit.
Yeah.
Now, am I willing to take a hit
mm-mm.
to know people aren't homeless? Have a house that younger people can get on the housing ladder? That people need to move from one home to another, or
Mhm.
find social housing, or find themselves in trouble, are not destitute? Yeah, I'll take that hit, right? It's not a
Okay.
tax, but for the well-being of society, I'd be happy to take that hit.
Okay, I'll hold you to that.
Okay.
Yeah.
When house prices go down,
Okay.
see
You-
if I'm crying.
I
but
hope
yeah.
you know you can't speak on behalf of your wife. You do
I
know
speak these
you're the one that's going to be looking
opinions
for somewhere
are
to
my
live.
own. They do not reflect my wife or my employer or my dog.
Or your dog.
or- yeah.
Because next time I see you, I don't want to be seeing you from a hotel room. Oh, Val, I'll be kicked out. Okay,
No.
let's move on to the last one.
Yeah.
The Health Foundation
Sure.
did a report called Health Equity in England. It was
Yeah.
in 2020. It was produced by the Health Foundation, and that was in collaboration with the Marmot review team, who we know that did. So that's revisiting the Marmot 2010 report with new data, because
Yes.
that's all we need is new
Uh-huh.
data. On top
And
of
so what did
old
they find?
data. Okay. It reinforced. Oh, I'm sorry.
Mhm.
Same old song, same
Yeah.
old tune. It reinforced all of the Marmot 2020 findings with deeper regional analysis.
Mhm. They were looking at the effects of austerity.
Austerity hit the poorest areas hardest.
Mm-hmm.
Those areas saw the biggest drop in health outcomes. So they really need a review for that. Poor housing, low incomes, insecure work,
Mm-hmm.
and early years education worsened. Blair introduced Sure Start, and we know that Cameron and Osborne took away Sure
Mm-hmm.
Start, which was for 0 to 5 years old.
Mm-hmm.
Things changed then because we talked about things, health inequalities, have a better start in life for children. That's why we had Sure Start. Every child is perfect, which is why the Tories took away Sure Start, because the work was complete. It was perfect.
Yeah.
And the other finding was healthy life expectancy differed by up to 19 years between rich and poor.
Are they talking about lifespan or health span? That is, people
Life
are
expectancy.
healthy.
Healthy life expectancy.
Someone is alive but unhealthy on their deathbed. It could mean that someone could be 30 years old, but they've got a serious health problem, and that they're just barely breathing and suffering.
Yes,
Yeah?
I know what you mean.
Yeah.
It does say here, healthy life expectancy. You know,
Healthy life expectancy. I suspect that's code for health span, making a distinction between just breathing versus actually living your life.
Some outcomes were strong evidence used by charities,
Mhm.
local government and campaigners. They supported the development of equity-based public health models in some cities, for example, Greater Manchester and Coventry.
Right.
But when it comes to a review or a report, it
Mhm.
was not adopted as official national health strategy. So it remained advisory. So I can advise you not to have that extra KFC. But
Right.
that's just advice. As I say, advisors advise, Dr. Jeremy decides. So it's up to you.
Right. Of
Whether
course.
you want to put that KFC, when you smell it, I'll bring it round to you, you can smell it, it's floating through the air. You'd have to
Mhm.
decide. I can tell you all the health and healthy eating. It's up to you whether you want to eat it.
Yes.
So that's it. So
Yeah.
it's either you do it or you don't. Those are strategies I don't like because it's not committed. It's
And
not.
for all these reports, they're saying the same thing over years. We've got evidence that social determinants, not just when you go to hospital, but all of the things about income and housing and work and all these things are driving health outcomes. We know the problem. It's been the same story for 40 years.
I'll say more, but we know, we've known for, let's go as far back as 1980
Yeah.
to the Black Report. We've known all these reports, all of them have the same theme, just like a stick of rock, as the same thing running through it. Health inequalities, social determinants, not just medical care, drive health outcomes. So the problem is not lack of knowledge. It definitely isn't. It's a lack of political action and structural reform, because they talk about all the time reform. They talk about change. They talk about putting money into the system. It needs more.
There were plenty of recommendations, but then something comes along and those recommendations don't get implemented.
They pick and choose their recommendations. When a government commissions a health report, let's stay on health, and they get someone eminent like Professor Marmot to do it, to produce a report, I don't believe it should be handed back to the government to implement. Things like this should come out of politicians' hands. It's like a political football.
What do you think about NHS England being abolished? And the idea was these arm's length organizations would take it out of the politicians' hands and manage things better. But what it's actually meant is the politicians, you can't really promise anything because they're not the ones in control. So right now, under Starmer, they've abolished NHS England as as a kind of
Uh-huh.
arm's length non-governmental organization
Yeah.
to say, okay, we're going to give politicians more power to implement changes they're promising.
They've never implemented anything. Even when NHS England were there were still things that the government would choose to do or not do. What I'm saying about these reports or any future report that comes up, and whether NHS England is there or not, our most prized possession in this country is the NHS, and I would imagine that the majority of us would want it to stay in its current form, where it's free at the point of use, is that when the government commission a report, because they are the government, is that the implementation of the findings of the report are not put in politicians' hands. They are politicians. They play political football with the NHS. It goes on too long. They look at the list of recommendations and pick and choose, or don't implement anything.
It sounds like you're looking for some system that requires a kind of mandatory implementing of recommendations or policy prescriptions, right?
There has to be something that's not in their hands, whether we have a Labour or a Tory government. The panel of experts just does this. Things aren't getting better. Money's being ploughed in. Politicians, like their sound bites, once something's out of sight, they've moved on. Politics is the next best thing. One day they jump about this, the next day about that. Nobody's singing on Grenfell anymore. Nobody's singing on PPE anymore. Nobody's singing. Do you know what I mean? Once it's out the news, it's out of their minds too. The inquiry's still going on, believe it or not. So
yes,
when it comes to health, it needs to be taken out of their hands. Just they're there. They've got the money. The department that's got the money. They're the ones that can say, okay, we will commission X report. And then just leave it. Stop waking up every Tuesday to announce PMQs on a Wednesday. We're going to commission another report. Because all that does is delaying tactics. These findings are over 40 years old. It's rinse and repeat and rinse and repeat. Nothing's changed. The only thing that has changed is that health inequalities is getting worse because the population is getting bigger. More children, more families born into poverty. So things are getting worse. I don't like it that every time a new government comes in, what the previous government did is scrapped, like Sure Start. They come in and want to do something else. And it doesn't make sense. They want to do something different, but at the expense of what? Look at the gaps when they took it away. It's like when COVID happened and that pompous health secretary, Hancock, said he wanted to decide whether somebody lived or died. Who made him guardian of the galaxy? Who crowned him king? He's not even an auxiliary nurse. What gave him that right to think it and then say it?
It's absurd.
This is how they see themselves. I don't think doctors like making that decision.
They actively dislike it.
It's safer in their hands because when's the last time he put in a shift? He's not medically trained.
It's a committee decision.
Exactly.
People who are qualified don't want to make that decision themselves.
No.
They don't want to be solely responsible.
No. It's a multi-agency decision, isn't it?
You want multiple perspectives so that you make sure that you're considering as many factors as possible.
So we know that inaction, what's not happened since, what changes were implemented, not many. Have any of the government's promises translated into better health outcomes? I don't know. So the next episode, what we're going to do is going back to 1980. That probably wasn't even born then. But excuse me, you're supposed to say something to that effect. I agree,
Yeah.
Val. You were
I think you were just a sparkle in your father's eye.
We'll go back to that.
Yeah.
We'll go back to 1980. We touched on it a bit today. We mentioned the Black Report. We talked about the Black Report,
Yeah.
Akerson Report, touch on the Marmot Review,
Mhm.
and get up to date with Lord Darcy, which Dr. Jeremy is more familiar with than I am.
Okay,
Yeah.
sounds
So
good.
We hope you've enjoyed today. We talked about a few reports from 2010,
Mm-hmm.
the Race Disparity Audit 2017, and the Health Foundation Health Equity in England 2020.
Yes.
Yes. We will do stories, labels, and misconceptions on next week's episode. Follow us on X, Instagram, and Facebook. Make comments. What
Yeah,
do you think of these reports?
We'd love
Yeah.
to hear what you have to say. Bye-bye.
Bye.